Alright, so last time we discussed the Picornaviruses with their Pico babies, right? We talked about what they do and the fact that they're the number one cause of aseptic meningitis. So if you get a question about a patient that is presenting with meningitis and it's, got the CSF findings of a viral infection, which, as we said, viruses are just nucleic acids, right? So you can have elevated protein, but the sugar should be normal and there should be no bacteria, right? So no organisms are going to be found, as opposed to bacterial meningitis, where bacteria are going to be organisms and they're going to eat the sugar, so sugar is going to be low, but protein is going to be about normal because bacteria aren't exactly completely just going to increase protein count. We talked about poliovirus, we talked about the echoviruses, right? The echovirus literally only causes aseptic meningitis. The others also cause aseptic meningitis, right? Especially Coxsackie and poliovirus. Rhinovirus was the only one over here that wasn't fecal oral. This one was respiratory. It causes the quote-unquote common cold, right? So that's your rhinovirus right there. And, as you can already guess, we haven't talked about rhinovirus specifically yet, but you can already guess, if the common cold keeps coming back and you keep getting sick over and over, then it must be changing in some way, right? Because you don't have a vaccination for the common cold. So when we do the common cold, we're going to see that and then hepatitis, HAV, we haven't talked about so much. We're going to do all the hepatitises together at the same time, right? So we found out HAV is a picornavirus. We already saw HBV was a DNA virus from the Hepudna, right? With the partially double-stranded circular DNA. So now the next big guy is your Flaviviruses, right? So the Flaviviruses are our first group that are enveloped, right? So there's no naked statue of David there for them. They're also single-stranded and linear, and icosahedral. That's pretty much the truth for almost all of them, right? They're all RNA viruses are single-stranded except for Rio, right? Rio is repeato, double-stranded. So Flaviviruses include your hepatitis C, yellow fever, dengue, St. Louis encephalitis, West Nile virus, which actually causes meningoencephalitis and flaccid paralysis, and your Zika virus, right? Now, the Flavivirus picture, let's get to it. Hep C, yeah, right here. Okay. So, what they did for the Flaviviruses is they made this like hepatitis. They made this Hep C drink, right? Where in America there is a drink. It's called High C. It's just a juice. So this is a play off of that, right? High C is now Hep C. It's a fruit punch. So Hep C, and the fruit punch part also makes sense because it has a flavor to it, right? So Flavivirus has a flavor to it. So this is just the left image right here is your Flavivirus sketchy micro image. So there's a lot of things happening here. Again, we can see our hippo because hepatitis is always going to be some kind of hippo. So it's called flavor packed Flavy. The orange hues and sunny day remind us this is a positive RNA virus, right? So you can see the sun with the plus sign from the light glimmering on it. The party goers are wearing a toga, and there is no naked David statue, right? So this is a virus that is enveloped. They are standing by the Nile and drinking Hep C juice, which reminds us of hepatitis C. And the Nile River is going to remind us of the West Nile virus. The straw in this juice box is linear and not curved to remind us that it's not segmented. Some of these guys are supposed to be segmented. Flaviviruses are not segmented. There are 4 types of dengue, but type 2 is the most important. Hence, his bone paddle is broken in 2 pieces. I skipped the first sentence. The brown rubber dinghy, which this guy right here, the brown rubber dinghy is to depict dengue fever, right? And we saw a dinghy like this earlier as well when we were doing bacteria, when we talked about leptospirosis, because that also had to do with fresh water and stuff. So this dinghy over here is for dengue fever. The guy is sweating and feverish as he swats off Aedes aegypti mosquitoes. It infects the bone marrow and causes breakbone fever. And then the type 2 is the most important one, so that's why his paddle is broken into 2 pieces. And that's not such a significant part to know, but if you see a question, and a question like that would most likely pop up on something silly like on an NBME, for example. So type 2 is the dengue that really causes the issue. Damage to the bone marrow leads to thrombocytopenia, and the red life preservers represent RBC because of hemorrhagic fever. Note also that the dengue resembles the leptospira dengue. So it's a kidney-shaped dengue with an artery and a vein coming out of it, the renal vessels. Right, so that's to remind you that it can cause septic shock and potential death due to renal failure. There is no treatment, which is why the guy is on his own and left to die. Right, so it's a really big issue. Um, I actually just mistitled it. This is part 12. The one I did yesterday was titled part 12 also, but that was actually part 11. I didn't skip a video or anything. I just titled it wrong. That's all. So no treatment for that. Dengue fever is pretty bad. I mean, there's more improvement on that now, but it's still pretty bad. The benefits now is just that fewer people are getting dengue fever. There's been more done for that, but for the most part, there still isn't a approved treatment as far as we need to know for the test. The yellow African water buffalo represents yellow fever virus. So that's this guy right here, the water buffalo. Yellow fever virus, a Flavivirus, also transmitted by the Aedes aegypti mosquito, buzzing around his face. Right, so there's a bunch of mosquitoes around his head too. Yellow fever causes jaundice, hence the liver-shaped mud spot, which is this one right here. His hump is exaggerated because backache is common in yellow fever. The guy standing on a red stool depicts the bloody diarrhea and potential bloody vomit that yellow fever can cause. There is a live attenuated vaccine for travelers, represented by the syringe on his back. So what these patients are going to come with is generally going to be, they're going to complain about back pain and there will be bloody diarrhea. Now, it's not excruciatingly bloody diarrhea, so they can't necessarily find blood in their diarrhea, right? But when you do a fecal occult blood test, there is blood. There are RBC in the in their feces. So that's what you're gonna get for yellow fever virus, right? They're also gonna talk about travel. It's gonna be a patient who went somewhere like near Egypt, near maybe somewhere some Arabic nation or India even, something like that. They went to one of those countries where mosquitoes are pretty prominent, and then boom, the person comes back with back pain and jaundice and bloody diarrhea. So that's definitely going to be very important. So that's going to be all your stuff for that guy. The next thing is your bird over here, these guys. So that's your West Nile virus. The bird depicts West Nile virus, and not only is it coming in from the west towards this way, this is the same bird, it's just coming this way. So don't think of it as multiple birds. So it's coming from the west, and it's on the Nile River, so that's your West Nile virus. The mosquito around its face is the Culex mosquito, and you do need to know. So the Culex mosquito is the only one you should really memorize uniquely, because everyone else is generally Aedes aegypti. Culex mosquito is your West Nile virus. So that's your Culex mosquito. The red feathers on its head resemble a turban, which symbolizes encephalitis. It's going to be the same thing every time we have encephalitis. It's going to be like a red turban kind of thing. The major complication of West Nile virus. Myelitis and meningitis are also common, depicted by the floppy neck and the neck brace. Right? Meningitis has always been a neck brace, respectively. The shaky bird depicts seizures, which can lead to coma, depicted by the sinking bird. Right? So this one is all like shaky and stuff as he's coming this way. That's for seizures. The one all the way over there that's sinking depicts the fact that it's going to die or it's in a coma. The encephalitis will be associated with the flaccid paralysis syndrome, and the patient may present with a morbilliform rash on their trunk and arms. And this, again, is going to have to do also with travel. It's not going to be a patient that was just in America the whole time and didn't go anywhere. There will be travel associated with it. So, always look out for that. If a question tells you this patient was on a business trip or they were visiting family, look at where they went. That's always going to be a big clue for microbiology questions. So that's your West Nile virus, right? And I have a URL question above for West Nile virus as well. Zika virus is the newest member, and there's just no treatment for it. There's no treatment for Zika virus right now either. Right, so that's all there is for that. That was your Flaviviruses, right? And we have our hepatitis C guy over here, by the way. The hippo for hepatitis C, which is also one of the Flaviviruses. But he's going to be discussed in his own image. The other guy we need to talk about from the Picornaviruses, right? We talked about Picornavirus yesterday. Just to wrap it up, I forgot to do one last thing for Picornavirus. It includes polio, echo, rhino, Coxsackie, and HIV. As we talked, RNA is translated into one large polypeptide that is cleaved by virus-encoded proteases into functional viral proteins. We saw that as well. Causes aseptic meningitis, except rhinovirus and HAV. All of them are enteroviruses as well, except rhinovirus and HIV, and we covered all of that. This picture here are the rhinos for the rhinovirus. Right? You do need to know the rhinovirus really well too, because it's the one that causes the common cold. So that's a pretty big deal. So this is your rhinovirus image. Again, same thing with the picornaviruses. You have your pico babies, you have your naked statue of David, so that tells you those details. Right? Rhino petting zoo. The orange hues on sunny day tell us it's a positive RNA. The pico baby hippos remind us it's a picornavirus. And you can see the sun in the back too with the plus sign. So it is a positive RNA virus. The statue of David on the right reminds us it's a naked virus. Transmission is via inhalation, and it is an acid labile. Virus, so it cannot go through the GI tract, which is unique compared to the other picornaviruses that are enteroviruses, the three in the middle, the bird ones. Transmission is via inhalation, right? So that's a pretty important part right there too, because the other ones were all fecal oral, and that was depicted in the summary picture that we did yesterday. The respiratory transmission is represented by the guy in the middle getting sneezed on, right? This one right here. He's getting sneezed on by that rhino baby. Fomites can also transmit it, so washing hands is critical, depicted by the sign about washing hands. This one right here, right? Please wash hands after petting the rhinos. The tourist on the left got her camera wrapped on the baby rhino, which reminds us of ICAM1. Right, so that's the receptor you have to remember for rhinovirus, ICAM1, which allows rhinovirus to attach to and enter host cells. This is also why David has a camera. So he's also holding a camera in his left hand over there. It's kind of harder to see, but this usually does a job for me. The rhinos in the back are in the shade to stay cool, which depicts that rhinovirus grows best in cooler temperatures around 33 degrees Celsius, seen by the machine telling the temperature there. So this machine right there actually says 33 on it. It's a temperature. It's not a machine, it's a thermostat. Infection affects the upper respiratory tract, so the baby rhino in the middle has mud all over its face. Right, so the same one that's sneezing has mud all over its face. Rhinovirus has 113 plus serotypes, depicted by the multicolored canopy. Right, this canopy with its different colors is always going to be a big deal. We saw something similar when we did African sleeping sickness also. That also had multicolored canopies. So that's why we can't really vaccinate against the common cold, nor is there really a treatment for the common cold. It's just supportive treatment. You get colds and then you get better again all by yourself. Don't start antibiotics just because you have a cold. It might not even be because of a cold, right? So that's your rhinovirus. A picornavirus, non-enveloped, RNA virus, common cold, more than 100 serologic types. Acid labile does not infect the GI tract because it cannot survive in acid, unlike the enteroviruses, right? And then we just talked about your yellow fever virus, a Flavivirus from this one right here, right? So it's an arbovirus, which means it's going to need a mosquito. All of them are always usually going to just be Aedes mosquitoes. The only Culex one was your West Nile. West Nile virus was the Culex mosquito. Virus has a monkey or human reservoir. Symptoms are high fever, black vomit, and jaundice. May see Councilman bodies, which are eosinophilic apoptotic globules on the liver biopsy. Not exactly the most high yield topic. Yellow fever virus isn't really that high yield either, but if it does show up, you want to remember a guy with backache and bloody diarrhea, and then here they mention black vomit and jaundice, and then the Councilman bodies. All right. Sketchy Micro didn't even really talk about the Councilman bodies, so that's definitely another little topic right there with the Councilman bodies. Let me make this big real quick. So you can see like a really tiny eosinophilic inclusion in the cell, and they have to tell you that this is actually from the liver, a biopsy from the liver. So that takes care of that. What was the next Flavivirus? Let me see. So we talked about yellow fever, we talked about dengue, St. Louis encephalitis, and West Nile and Zika, right? So those are all your Flaviviruses. Right here is a question on West Nile. So this one says, a 68-year-old woman is brought to the hospital due to lower extremity weakness. For the past 3 days, she has had malaise, headache, and myalgias. She is experiencing bilateral leg weakness. She's never traveled outside the USA. Temperature is 101 F, blood pressure is 130/70, and pulse is 96 per minute. The Patient is confused, has a morbilliform rash on her trunk and arms, and flaccid paralysis of both legs. Lumbar puncture and PCR shows viral RNA. And the answer was it's West Nile virus. Patient must have been bit by a mosquito and contracted West Nile virus. Fever, rash, encephalitis, and flaccid paralysis hint at WNV. West Nile virus, Togavirus, and Bunyaviridae are the most active in summer and fall. Right, so of course, now this question was pretty unique from UWorld. I didn't quite agree with it because they said that this patient has never left the USA. Now there are mosquitoes in USA too, yes, but it's usually a rare thing for someone to be contracting, West Nile virus in America itself, because it's very rare to get bit by a mosquito here. Like, it's just not that common of a thing. But it didn't matter that this patient had never left America. They gave enough symptoms for you to actually be able to cast the fact that this is viral encephalitis. And when you see viral encephalitis with flaccid paralysis, you want to think of West Nile virus. You want to think of that bird that's having seizures and coma and just like flaccid neck, meningitis, encephalitis. You get that in there, it's a Flavivirus, you're done. Right, so those are your Flaviviruses. That takes care of that. Before that, we had a little guy, Calicivirus, right here. Right, Calicivirus is just your non-envelope, so it's a naked, single-stranded, positive linear icosahedral virus called the Norovirus. And all this causes is viral gastroenteritis, but no other real symptoms. So it's usually easy to pick as well. And of course, for this, they had a Game of Thrones reference with Khaleesi. So they have the dragons on the boat too. So this is your Calicivirus picture. So let's take a look. Okay. So Calicivirus, Cali-C cruise, and it's often going to be viral diarrhea, gastroenteritis on a cruise. That's going to be like the general question stamp. The orange hues and sunny day tell us it's a positive RNA virus. So you have your sun with the plus sign. The three dragons on the ship are a reference to Khaleesi from Game of Thrones. The statue of David is at the bottom right to remind us it's a naked virus. The cruise line attendant is ripping tickets from one big strand to depict the one big non-functional polyprotein that needs to be processed by viral proteases into smaller functional constituents. Right? So anytime you see tickets, and we saw tickets with the Picorna as well, right? With the Picornavirus image right up here, they had tickets as well for admission to the zoo. Here we have tickets to get onto the ship. So it's a very common theme with positive RNA viruses to have a very big polyprotein. Because remember, positive RNA viruses are pretty much equivalent to an mRNA. So they are making protein. They are capable of direct translation. Norovirus is the most common clinical calicivirus, depicted by the narwhal in the back. So that's a narwhal. Outbreaks are common on cruises and causes watery diarrhea. It is also strongly associated with young kids at daycare centers and schools. So the passengers on the board are kids. It is lastly transmitted by shellfish, which was also a fact for hepatitis A. We haven't done it yet, but hepatitis A is also strongly related to shellfish. And we're going to see that when we get there. The viral enteritis leads to explosive watery diarrhea depicted by the propeller and the mud it's shifting. As you can see, this is not red, nor are there any red stools or anything, so this propeller is showing you watery diarrhea right here. Incubation takes 1 to 2 days and self-resolves. Right, so it's going to be like a 4 or 5 day cruise or something where this started happening. Right, so just like pneumonia has many bugs, meningitis has many bugs. Right, both things also had very unique target societies, right? Target groups of people, whether it be like army or college or whatever it be, or old people, immunocompromised people, etc. Just like that, diarrhea is also one of those things. And so far, we saw a lot of diarrhea from bacterial things, right? We also saw a lot of diarrhea when we did the mycology, right? Even like right in the beginning of mycology, we had a bunch of different bugs that can cause diarrhea and different types of diarrhea, where it was fatty diarrhea, watery diarrhea, or bloody diarrhea. Now we're seeing a virus that literally only does one thing, and it causes watery diarrhea. Nothing else, though. You're not going to see anything else. So if you get a question about a cruise and some people develop diarrhea, and then they also got better without treatment, right? Nothing had to be done. You just gave them water or something. You know it's viral, and you know it's just norovirus, which is a calicivirus. Right? It's a very easy, very straightforward bug to work with. Nothing too intense there. Right, so that knocks out your calicivirus as well. We haven't done reoviruses yet. We'll come back to that. This one's also an easy one to knock out, so we can do that. Coronaviruses. Right, so coronavirus is also enveloped, positive and helical now. This is the first one we're going to see, which is helical. Right? So far, everyone was icosahedral. Now we have a helical one, and the image does a pretty good job to help you remember that. It causes the common cold as well as SARS and MERS. So if you haven't heard of what SARS and MERS were, you missed out, because there was a pretty big moment where SARS was a problem here in America as well. So let's take a look. So this is your coronavirus image. Coronavirus, kingdom of SARS. The orange hue and sunny day tells us it's a positive RNA virus. Corona is Latin for crown. It's Spanish for crown. So our scene is at the countryside of a kingdom, and our king has his crown on. His white robe tells us it's encapsulated, and there's no naked statue of David. And the helical patterns on the hills, aspiring roads, and the kingdom tell us that it's helical. SARS and the common cold are the main issues here. The king is sneezing and blowing his nose for the common cold. That's not so bad. Different strains of coronavirus can cause SARS and MERS, which is Middle East respiratory syndrome. The king's shirt has bronchi splitting into bronchioles, depicting acute bronchitis and acute respiratory distress. Clinically, the test of antibodies to SARS, or PCR for antibodies, is what's going to help you diagnose this. Absence of antibodies over 28 days is a negative test, and there is no real treatment. Right? So it's really just going to cause acute bronchitis, and the patient can actually just end up dying from it too. So it is pretty bad. But generally speaking, the question isn't gonna tell you anything that leads you into thinking it's a bacteria, or it's like the other guy that we just did, the Rhinovirus. It'll tell you a lot more than just that. And those little details are what you're gonna have to remember. So you're probably gonna have to remember it's helical, or remember that it is encapsulated as opposed to Rhinovirus. Right? Rhinovirus is one of your naked guys. Right? So that's little characteristics like that are what you're possibly going to have to use to differentiate between who caused this common cold. Let me see. So Togavirus and retroviruses. Now, Toga is a pretty big deal as well, because that has rubella in it. Right? Rubella. You need to know the difference between rubella and rubeola and how you're going to memorize that. So let's take a look at Togavirus. Let me see where our Togavirus guy is. So I think this is him right here. Take a look. Yeah. He's a pretty big deal. So this is your Togavirus picture. Let's take a look at that. It's a very important picture. This picture actually helps remember a lot of answer choices, because after I started teaching using these images, and then I do practice questions with students, I often recall the answers correctly because of these sketchy micro images. And then when the student asks, they go, how do you remember that? I tell them it's because I looked at the sketchy micro images and I studied them, so it did help a lot. So this image here is for Togavirus. Alright, and there's a lot of things here. There's this guy on the side with the horse, there's this vaccination stuff, and then a bunch of imagery on the wall in the back. So Togavirus. The scene is in a Roman city with orange hues and a sunny day. So this is a positive RNA virus. The togas in the scene also serve to remind us this is enveloped. There are two types of Togaviruses, arbovirus and rubella. Arbovirus is illustrated by the man riding on a horse at the bottom right, and he hits his head on an arbor, which causes his red turban to fall off. The arbor will remind you of arbovirus, which stands for arthropod borne, so some kind of mosquito or something. And you can see there's a bunch of mosquitoes, tiny dots. They are transmitted by mosquitoes, hence the mosquitoes are on his head. There are three: Western, Eastern, and Venezuelan equine encephalitis viruses. The word equine means a horse, so the horse should remind you of that. The compass on the back of the horse reminds you of these geographic names. Right? So there's a compass right here. The compass itself will remind you that there are geographic names for it, so Western, Eastern, and Venezuelan. His red turban depicts encephalitis, which can present with headache, fever, altered mental status, and focal neurological deficits. There is no treatment, and compared to the other guy that caused encephalitis and encephalitis. Yeah, the other guy that caused encephalitis also had flaccid paralysis, right? Your West Nile virus. So compared to that, there is a difference here. There's no treatment, and that's it. That's it for that. Chikungunya is also a Togavirus, and this is a newer big deal, right? This was a really big deal in India very recently. That's also a Togavirus and presents with febrile illness with flu-like symptoms, prominent polyarthralgia and arthritis, and a diffuse macular rash, and it's transmitted by the same Aedes aegypti mosquito. that transmits dengue. So many places have had simultaneous outbreaks, especially in tropical and subtropical regions like South and Southeast Asia, Pacific Islands, and the Caribbean. All right, so that takes care of all your mosquito-borne guys that are Togaviruses. The other big deal when it comes to Togaviruses is rubella, one of your torches infections, right? Rubella, also known as German measles, is centered around an emperor child because it affects children. You can imagine the rubella child is Hitler because Hitler was German, and rubella is also called German measles, right? So he is pretty much an emperor here. Rubella can be congenital in childhood or in adulthood. There are torches because it's actually one of the torches infections, right? You can see all the torches that are lighting up this empire. So that's the R in torches. The emperor's crown has rubies for rubella, and some are falling down his neck because rubella causes tender post-auricular lymphadenopathy, and this is often given in a question, right? Lymphadenopathy behind the ears. The rubies falling from up to down tell us that the maculopapular rash begins from the face and goes downward. The rash of rubella moves faster than the rash of measles, which is rubeola. And that comparison is always going to happen. You're going to have both answer choices there. There's going to be a lot of confusion. So you have to be able to pick out whatever it is that can help you pick one over the other. So the rash moves faster for rubella, and it doesn't darken or coalesce. It's not going to the rash is like more further apart. The dots are going to be further apart. They're not going to be all like jumbled up together. The rash is typically present only for 3 days. Spread is via respiratory droplets, depicted by the water droplets from the fans of the servants. Rubella can also cross the placenta and infect the child in utero. The constellation of symptoms are mental retardation, microcephaly, deafness, blindness, cataracts, jaundice, PDA, patent ductus arteriosus, pulmonic stenosis, purpuric blueberry muffin rash, and radiolucent bone lesions, right? So it causes a shit ton of stuff. But the main triad is the cataracts, sensory neural deafness, and a PDA. The triad is depicted by the baby image on the wall with the creepy eyes and the covered ears, right? So all these babies right here. The arch in the wall is in the shape of a muffin, right? So this is like a muffin-shaped arch with blue little diamond thingies for blueberry muffin. The drawings are yellow to depict jaundice, right? All the baby drawings are yellow all around. Adults will have lymphadenopathy and fever with arthralgia and arthritis depicted by the servants who have knee pain. Right, they're on their knees on like really solid floor, so that's obviously going to hurt. Also, this entrance point here is called aqueductus arteriosus to remind you of patent ductus arteriosus. So a PDA is a really big deal when it comes to rubella. Right, and the reason that kind of happens with rubella is, remember, closing the ductus is all about muscular proliferation, and rubella kind of slows down that muscular proliferation, so the ductus doesn't really close. That's a little thing you can get a question on as well. Rubella has no treatment, and we cover it with an MMR vaccine. It is a live attenuated vaccine that induces both humoral and cell-mediated immunity, so CD4 and CD8. This is depicted by the live puppet show with 3 puppets for 3 viruses, MMR. Right, live for children puppet show, 200 tickets. The 200 is significant too. The left puppet is pregnant, and the middle puppet is saving her from the right puppet with the vaccine syringe. That tells us the MMR is not administered to pregnant women or immunocompromised patients or HIV patients with a CD4 of under 200, which is why you have this ticket booth with 200 tickets. Alright, the ticket booth also tells us that togaviruses make one long dysfunctional polyprotein that gets cleaved into active proteins by viral proteases. Very similar to Picornavirus and Flavivirus, everything that we saw so far. Watch out for immigrants who may be unvaccinated. That's a very common thing when it comes to rubella. Any question you get about rubella often has a patient who came in from a different country, and now they themselves might be having rubella symptoms, or they might have a child now who they brought with them, like a young child they brought with them from another country, and that child might be exhibiting rubella. So we can kind of see that in this question right here. Right, this is a URL question down here. It says, during the first trimester of pregnancy, a 22-year-old immigrant from the Middle East develops a low-grade fever and maculopapular rash. Over 48 hours, the rash spreads from her face and chest to her trunk and extremities. Physical exam also depicts post-auricular lymphadenopathy, which should now really start making you think it might be rubella. The mother is at risk for which of the following immediate complications, and the fetus is at risk for which other following congenital defect? So the correct answer from multiple choices over here was the mother would have polyarthralgia, right? Because you can see the adults have that arthritis stuff happening with their knee, and the infant would have deafness. And these answer choices could have been many other answer choices as well, any combination. The patient's immigration history suggests she may not have been vaccinated against measles, mumps, and rubella, MMR, at the 12 to 15 months of age. Measles, which is rubeola, and German measles, which are rubella, are two acute viral exanthems whose maculopapular rash begin on the head and neck and spread downward. This patient's presentation is of rubella. Maternal rubella infection produces a low-grade fever, a maculopapular rash with cephalocaudal progression, and post-auricular suboccipital lymphadenopathy. Most adult women patients develop polyarthritis and polyarthralgia as sequelae. Congenital rubella syndrome is associated with sensorineural deafness, cataracts, and cardiac PDA, right, amongst many other things like jaundice and blueberry muffin rash that we also discussed. And when we look at rubella over here, they show you more, right? So rubella is a Togavirus. It causes rubella, once known as German measles or 3-day measles. Fever, post-auricular and other lymphadenopathy, arthralgias, and fine maculopapular rash that starts on face and spreads centrifugally to involve the trunk and extremities is pretty much going to be your common thing. So you can see it starting on the face and it's going downwards with this picture they have here. This picture here shows you the blueberry muffin rash. Right? It causes mild disease in children, but serious congenital diseases. Congenital rubella findings include a blueberry muffin appearance due to dermal extramedullary hematopoiesis. Right? And that's what we're seeing over here. This is another rubella question. It says an infant born to a 27-year-old immigrant is evaluated for hearing loss. And immediately when you see that in your first sentence, you should think rubella, right? Because that causes sensorineural deafness. Physical exam demonstrates white pupils and a continuous machinery murmur over the left infraclavicular area, which pretty much confirms rubella, right? Because rubella also had to do with a PDA. That's how you have your continuous machine-like murmur. They say which of the following preconception interventions would have most likely prevented this infant's condition, and the answer is giving a live attenuated vaccine. Congenital rubella syndrome is characterized by deafness, cataracts, PDA, microcephaly, and mental retardation. Live attenuated vaccination is recommended at 12 to 15 months and 4 to 6 years of age, but also in non-pregnant women of childbearing age who lack serum antibody against rubella. And the woman is advised to avoid pregnancy the next 4 weeks, right? So they said preconception, which is really important to remember. So before she got pregnant, she should have gotten the MMR vaccine, then waited for like at least a month or two, and then go ahead and try to get pregnant, right? And now the baby wouldn't get congenital rubella, right? So you can't vaccinate a pregnant patient because it's not going to work the right way. It'll actually cause infection instead of vaccinating them. So, that's the big little thing to watch out from this question. You can give these vaccinations to a mother that's trying to have a baby, but you have to wait and do it before they get pregnant, and then wait a little bit after the vaccination as well before trying to get pregnant. All right, so that was your rubella, your German leader for German measles. This is why you always remember rubella as your German measles, right? This image is rubella. Rubella is the one that causes cataracts, sensorineural deafness, PDA, blueberry muffin rash, live vaccination, and then of course all these guys with the horse for equine viruses, West, East, and Venezuelan equine. All right, so that's your rubella guy right there. Let me see now. So we talked about Togaviruses, Flavi, Calisi, Hep E, Picorna. Retrovirus is a big deal because that has HIV. So we haven't done retro. We haven't exactly talked about any of the hepatitis yet. Did corona. Orthomyxo is a really big one as well for influenza virus. And from here on, it's all negative RNA viruses, right? So after what we just covered so far, everything was positive RNA viruses. From here onwards, we have your orthomyxo, paramyxo. They're both negative. Rhabdovirus, which causes rabies, that's also negative. Your filovirus that causes Ebola, really big deal, right? Recently had a very big outbreak of that in many African countries. A rhinovirus, not the biggest deal, but definitely something you need to know. Bunyavirus, also not the biggest deal, but you do need to know it. And then, of course, your negative hepatitis, delta virus, right? Negative RNA. And all the negative viruses are going to have nighttime with the moon and a cloud floating in front of it. That's going to be all your negative stranded viruses, right? For negative RNA viruses, you have to transcribe the negative strand into a positive strand first. And then a positive virus or a positive strand is actually equivalent to an mRNA. So to do this, a virion brings its own RNA-dependent RNA polymerase. So you can take your negative RNA and make a positive RNA out of it. And that includes all of these guys that we just named right now. Arena, Bunya, Paramyxo, Orthomyxo, Philo, and Rhabdo. Right? Very easy to remember them. It's really not that hard. And of some of these guys, you have segmented viruses. Right? All segmented viruses are RNA viruses, and they include Bunya, Orthomyxo, Arena, and Rio. And when we look at your Bohr guys, right, Bohr, when you look at your Bohr guys that have your segmented viruses, the sketchy micro picture is going to do a really good job in helping you understand how to remember that it's segmented, right? So far, we haven't talked about any virus that is segmented. So I'm going to stop here, and then in the next video, I'm going to go ahead and go into your big guy, influenza virus, and talk about the flu, and then move on to the rest of your negative RNA viruses.